growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I'm Dr. Steve Rasner. Welcome to The Lionhearted Dentist. Well, here we are in week 4 of the first month of 2021. How's everybody doing? I want you to write to me at Dr. Rasner, D-R-R-A-S-N-E-R at AOL. If you'd like me to bring, most podcasts have other guests, and I've never had another guest. This podcast to me is like a conversation with you guys after work, on the weekend, with somebody that hopefully has some knowledge to share with you to maximize your ride and to make it less eventful, less full of the mistakes I've made. So that's what I am. But that doesn't mean I can't mix it up. And I certainly am pretty well connected in the industry and can bring on, and probably saying that to you because I've had over the last few months a number of other known thought leaders wanting to be on this show. So if I get a couple of emails that say that, I'd be more than happy to make that happen. I told you in the last couple podcasts that I'm done messing around. And what I mean by that is I need to really impact change in those of you that follow me regularly. And so tonight's podcast, which is after one of my work days, by the way, which, I don't always do that. A lot of times I do these on the weekends. I don't know what they sound like, but I think my thoughts are more fresh, relevant to what happens in your office each day, because it just happened to me, So today's podcast is going to be focused on the goals that you should be setting right now. Don't turn me off. Do not turn me off. The goals that you should be focused on, the goals that you should be writing down, literally writing down. I'm going to go over them with you right now. And, there's only so much I can do in 30 minutes a week. But I've said to you before, and as I'm sitting in front of you right now, I'm so focused this year to get your mind straight and narrow out. What do you need to do first to make this the breakout year? Please, do you understand at this point that the success I've shared with you, the amazing month I'm having, there's no way it's unique to me. What it is the product of me doing things that I've done for a very long time. And they're the things I'm trying to bring you early on. It's so easy for you to get distracted, even by the end of the first month of this year. I get it. So, first thing I want to say to you is relevant to an email I received. It's not really a goal thing, but one of your colleagues and my colleagues wrote to me and mentioned that I never bring up the importance or even mention photography in my case presentations. So the very first thing I'm going to tell you is I remember when I found it necessary to go out and purchase a professional quality caliber camera for dentistry. I didn't have it my first couple years. And if you're listening to this podcast, you need a camera. You absolutely do. For really one major reason, or two major reasons. One is every anterior case you do, whether it's a single crown or a roundhouse, needs to be photographed for legal reasons before you start. God forbid a margin of a tooth goes north on you, goes apically, or was there already, and the patient didn't notice it. And let me tell you something that absolutely happens. When patients have work done, think about yourself for a minute. I had my front 2 teeth done 3 years ago. And when I was in provisionals, for the first time, maybe ever, I literally studied the nuances of the aesthetics of my front teeth. Were there crack lines? What were the different shades? And I think I did a good job, by the way. And so people look. They may not have looked for the last 10 years, but they decided to invest in you in 2021. You better document that for your own sake. And you should document it beyond even legal reasons. You should document it because you want to know where you started with a case. We document the occlusion, all sides of the aesthetic zone. I probably don't do it as thoroughly and as well as the AACD recommends, the American Academy of Cosmetic Dentistry, but you should. And you should get yourself a quality camera, and you, quite frankly, can write to me and I'll give you my resources or what I would recommend. So to the doc out there, here's how I use photography in my case presentation. We have a multitude of ways to show before and afters. And I'll be quite frank with you. Sometimes I like hard copy. I don't know the psychological reason why that works so well, but when a patient can hold in their hands a really blown up, nicely wrapped before and after of a patient, I think it's very powerful. I also have them on the computer. I'm going to be 100% honest with you. I absolutely think you should do what I just said. Maybe this is the year. Maybe that's one of your goals, which I'm about to get to in 2021, of starting photography on a regular basis. There's so much you can do with it. You're going to see later on, I'm going to talk about professional goals for you this year. And one of my professional goals is almost always write an article for a national magazine in the industry. Well, you're not going to get anything published unless you have photographic documentation. So it is really the beginning of taking you to a different level. What I started to say to you is, I think the case presentation protocols that I have gone over with you, and I'm going to go over with you many times in 2021, that I can get away with whatever I want to get away with whether I'm heavy on photography or not. And when I say get away, I want to point something out to you. That's not getting over on anybody. That's not tricking any of my patients. I am quite the opposite. If there's one thing that has become better in my overall skill set, it is relating to the patient in the operatory at an incredibly high level of being earnest, them knowing I am truthful, them knowing that I am trying to give them the most conservative approach that is appropriate in their given situation. Let me expand on that. So if somebody comes into me with a complete dentition and they break off the upper right first premolar, conservative approach is an implant to me. I don't want you to get confused and think I do a 3-unit fixed bridge because their insurance will cover more or that costs them less money. No, it's what the most conservative approach that is appropriate for that particular given patient. Let me give you an example. I had a patient in my chair today, 85 years old. She has not been in since 2018, so it's 2 years out. A very good patient. And like I'm sure many of you, I've noticed a retaliation, if you will, of acute and advanced caries in a lot of my patients that haven't come to the dentist. And I'm talking about patients that didn't need anything for a very long time when they were regular patients with me. But COVID sent them out. Or in this particular case, it was even beyond COVID. And this is tremendously good-looking, healthy, 85-year-old female. And her chief complaint was number 13. She was in recall, by the way, which is another thing I'm going to talk to you about. And it was non-restorable. So how did that fly? Hold on before I finish. She also had significant caries in an intact dentition, by the way, on upper right first molar and the lower right second molar. This lower right second molar was underneath an existing crown prior to me. Not to say that I don't have crowns that I've done that get recurrent decay, but this one wasn't one of them. So it's a little bit of a quagmire for me because I didn't want to overwhelm her. And by the way, she was only symptomatic on the other upper left premolar. So I sit down. Now, I've known this patient quite a long time, and I've done a lot of work on her in my career. I sit down in hygiene, haven't seen her in a couple years, ask her how she's been. The x-rays are up in front of me. I've already reviewed my Cliff Notes, which, again, I'm setting up a lot of things for me to get back to on this podcast. There's specific hygiene Cliff Notes I get before I go in, so I have an idea of my history with this patient. Very important, especially if you have more than one hygiene schedule that you're responsible for on a given day. And I walk in, the first thing I do is listen, look, Carol, you're going to have two choices here. And I take a hand mirror. I have intraoral cameras in all my rooms. I hand her a mirror, like the type of mirror that you can buy at Walmart for $2 or a convenience store. Nothing fancy. Every room has one in it. And I just handed it to her. I didn't even say anything. I said, smile, look in the mirror. She goes, oh, you can see it. I said, you can. I said, not in everybody's mouth, but in your mouth you can see it. So here are your choices. We can remove it, and you can do nothing. Or, that's the first thing I said. And her response to me was, well, no, I can't do that. And so trying to shorten this story, which I didn't intend to give you, but hopefully it helps some of you. I said, well, I got to talk to you about two other teeth. And I talked to her about 3 and 31, both asymptomatic, both, certainly 31, lower right, second molar, was into the nerve, according to my x-ray and according to my exam. I said, it's hard for me to tell you what to do. I said, if that tooth, which I'm pretty sure is in your nerve, you certainly could remove that tooth and it would be no problem at all. I don't think you'd really notice. So I kind of was leaning and setting it up towards an extraction because I certainly wanted her to save number 3, which needed a core and a crown. I mean, I don't know what all the numbers are at that moment when I'm talking to the patient, but I know we're doing an implant extraction. I know that it well could be, $8,000-9,000, and that makes me cringe. And the outcome of it was, as she asked, and she must have asked me 3 times, why don't they hurt? We all get that story, right? And my answer was, because that's the profession I chose. I chose a profession, unlike a dermatologist, where much of the pathology doesn't hurt the patient. It would be much better for you guys if it did. So, listen, I said, you could go home, and this tooth may never hurt you. Never. Or it could bother you tomorrow because I brought it up today. That's how I talk. She put those 2 teeth on hold. Remember, this is a person with an intact dentition. I mean, I don't know what the line is for you or how much pressure you want to put on a patient. My priority for her would would certainly be the one that was symptomatic and the one she wanted to replace. Anyway, that is how the recall system pays dividends in my office. That is my approach. I don't know if I've conveyed it enough in the last several podcasts or the last year, but I got to tell you something. I really try to be conservative with my patients. Here's a common expression I'll say to my patients when I walk in the room to them. It's the way I feel. I say, you know what? I don't know if you know this or not, but I've been in this 40 years now. And when I walk in your room, I am really hoping that you don't need anything other than the recall that you're here for today. You understand that, right? I don't want them to think that I want them to need things, because I don't. It's easy because it's truthful, and you should, if you are a Lionhearted dentist, you should adopt that and try it. It's a wonderful, refreshing, liberating approach to walk, even with a new patient. Because if you do right by people long enough, and we've had many examples in our last podcast, we talked about every day trying to do something to build relationships with your patients, both clinically and non-clinically. Clinically, doing something you don't charge for. Maybe it's an extra couple surfaces that you miscalculated. Maybe it's re-cementing a crown that came out for whatever reason, wasn't your crown. It's not perfect. It's got a hair of decay. Look, I know I could get debated off the stage for talking like this to you. I'm just telling you, you have a gigantic responsibility in the community that you're building in your practice. You have a little city there, and you're the mayor of that city and the dentist. You are. And so I'm still in it for the long run. I mean, I'm 66. My patients know that I don't know when I'm retiring. I certainly can if I want to. But they also know that, like I'm sure many of yours, they don't want you to retire. Trust is everything, man. And trust you have to earn and continue to earn. Look, I don't remember what I was like when I was 40. I probably was hoping I would get cases all the time. I think the difference is this. If you do right by people all the time, and that is a big statement to make. Like I say to patients also, not only do I not want you to need a lot, but if you do need a lot, I don't want you to feel pressure. And if you feel too much pressure, I'm okay with us either not doing anything, if that's possible, or doing something that won't pressure you. I'm telling you, I don't know if that's what you guys want to hear, but it leads. Remember, I didn't sit on here tonight, as you know, and tell you I don't do comprehensive, complete exams, no matter what they came in for. I do that. You know, I didn't stop with the patient I just alluded to on number 13 that was obviously hurting her. I looked at her entire mouth because it was relevant. So let's get to a couple questions I wrote down before I came on tonight. And they were, have you done anything since the last podcast about goal setting? You still have time. But in the next week, and that's about it. You don't have to overcomplicate it. But you need to know that if you don't write goals down, it's a staggering percentage of those for you to accomplish less than those who do write their goals down. So you got to break your goals up into, because there's different elements of your life. There's professional goals. Maybe I used to say I'll add a second day of hygiene if you only have one hygienist by June 1st. So now that that's your goal, you have to act on that goal. What that means is on June 1st, which isn't that hard. I mean, for goodness sakes, that's 5 months from now. You're trying to write realistic goals, maybe a little inflated. So those of you with one hygienist, I think it's a good thing to have it, because I so believe that your hygiene is the backbone and the barometer of a healthy practice. I believe you need to work to build that. And if you don't, it'll just never happen. You'll go through a 30-year career and have one hygiene when you could have had 2 or 3. Are you telling me, Steve, that all I have to do is write it down and it'll happen? Exactly. That's what I'm telling you. I mean, if you can't fill your first hygiene schedule, no. But if your hygiene schedule's fairly consistent and you want another schedule, which I would recommend, that's how you start it. And when you get to June, you add a second day. Look, man, the years go by quickly. Does anybody need to be convinced of that? And before you know it, you added a second day, then a third day. And then you have 2 full hygiene schedules. You put them out 3 months every time. I gave you the first one in June. You put them the second day and then the third day, you give your front desk 3 months to fill that. And it's the same with an associate, by the way. Maybe one of your professional goals is that you want to submit your first article. Now, maybe you'll get rejected, by the way, but you'll never get one in if you never submit. Or maybe it's not going to happen in 2021, but maybe in 2022, you'll begin to lecture on a study club level. It's cool stuff. I mean, I think it is. Personal. Personal means I'll lose 10 pounds by March 15th. That's how you do it. You don't say, I'll lose some weight this year. That's not a goal. Nothing will happen. I'll enroll in tennis. I'll enroll in whatever. Please, believe me from the Lionhearted master dentist. Get your brain somewhere else besides dentistry. I didn't take up tennis, although I did many other things, until I was 60. And I stink. And I am determined not to. That's not a goal, by the way. That's just me telling you that. And that hasn't happened either in the last 5 years. Financial is very big. Some of you have a lot of credit card debt. So it's kind of hard for you to start saving money. You need to save money. You need to get those credit cards down. I am telling you, you don't want to take my word for it? Then go do some Google research. You're going to hear and find in your research what I'm telling you now. When you write things down, there's an old saying, when you leap, the net will appear. When you go with earnest in a direction, it starts to come to you what you're trying to achieve. Before I take that another step about saving money, which over my career of 22 years of being a speaker and a coach, I've met many of you in perilous conditions financially. And I've been in them before too. You may not know what your numbers even are, right? Some of you listening right now don't even know what your numbers are. You don't even really know your net. I mean, you know what your tax statement is, or maybe you have an associate and you really don't know what you're making off of them. Or maybe you have a hygiene team. So call me or go on your own, and I hope she doesn't kill me for this. I don't know why she would, but there's a woman named Annette Woods. Annette Woods. She's an ex-hygienist, a financial virtual bookkeeper in Jacksonville, Florida. I pay her monthly to tell me everything I just said to you. She's got complete access to all my accounts, and I have somebody outside my office. Now, if you have a family member that you trust, maybe you don't need that, or if you have this information, maybe you don't need that. Okay. I'm looking at my notes I wanted to go over with you. So here's some really quick goals that I'm going to have to elaborate on next week. One is, what's up with your recall system? See, that's the easiest thing to fix. And then one of the most important things for those of you with a practice to address right now. If you are in a, what I like to call a horizontal growth chart, in other words, you're not growing, you're stuck where you're at, I'd like to suggest to you that one of the reasons may be that there's too many patients going out the back. You've heard me talk about this in the past. You need to have a meeting and enlist some of the people in your team and perhaps instill a financial reward. I tell you everything else. I may as well tell you this. I used to pay, basically, I have different ways of doing it, $10 per recall. And to be honest with you, I think it's up at $15 per recall. Now, that's not your front desk rescheduling somebody. That's research that they did, and they found somebody not in your system, and they can't get paid on any of them until 10 come in. Not on the 8th or the 9th. And if there's a month hiatus till the 10th comes in, that's the way it is. So I have 18 to 20 staff members from time to time. I have only 3 that seem to care about that system at all. And some of them make absolutely $100 a week extra. If you're going to sit here and argue with me the power and value of paying $15 to get a new patient, because you're not going to pay for them until they've come in your office back and again, you are barking up the wrong tree. I think it's a completely fair deal. Okay, so that's goal number 1. What's going on with your recall system? If you need elaboration, then just please write to me. While I'm on it, I want to talk to you about the Hygiene Check system, which I've talked about in another podcast. That means, so on Mondays and Wednesdays, I have 3 hygienists, which doesn't feel good, by the way. The only way I get away with it is some of our patients are in every 3 months that do not need me to examine them. And my patients know, and I've talked about this with you before, that I am a stickler, because I tell them I'm a stickler from day one about their periodontal health. I don't care if they got scale and root planed a year ago. If they fall off the wagon, they're going to hear me talk about this. They know that I have more work than I need to do, and so will you. If you follow all of these protocols, or a lot of them, not even all of them, you're going to be busy, man. That's what I meant when I started this podcast today. And I said, this isn't unique to me. You just don't work hard enough. I don't know, you may not want to hear that. And if you're fine and happy, then don't do anything different. But if you want it better, I mean, I can do this for 4 days a week. My hours aren't as bad as they used to be, and neither will yours. It's hard to create an organization and a product that is in high demand, especially when you're in a challenged economic part of your country or your state like I am. But it is replicable, my friends. And that's what I'm giving you every week. And the only thing that I get out of it is that some of you take my courses, which, by the way, are March
19th and 20th.
So 2 months from now, for implants, those of you that have completed a didactic curriculum, or maybe you did them in your GPR and you haven't done them since, and you've heard me talk, that course, unlike the one in the fall, is fairly easy for beginners. You're doing the surgeries. I totally take you through it, but I have an agreement and the ability for you in any state in the United States, as long as you have a active license in that state. So all you got to do is write to Beth, and it may be sold out for all I know. So you can ask her. And then the following month, April 9th and 10th, we're having our extraction and grafting course, which is another tremendous course. I mean, it's rewarding when you're there, and I establish these personal, nice relationships with many colleagues from, by the way, from 25 to, I don't know, 70 something all over the country that come to my office to do this. And that's what motivates me. Anyway, there are the dates. Check with Beth. And there's 2 other courses in the fall. So back to the goals. What's up with your recall system? The hygiene check system, which I never explained to you, I'll just have Beth mail it. So each hygienist finds wherever I'm at. They don't have to say a word. I'm usually in surgery. And they'll just put down their hygiene slip, which tells me they're ready. And at some point, or they write the time on top of it. I don't even want them to talk to me. This is why the system exists. I don't want to be interrupted when I'm with the patient. And they'll just drop it. I'll look at it and know that at some point in the next whatever, I need to get up. And it tells me last work we did, any current observations by the hygiene team that they want me to take a look at, any concerns of that patient. You get me? Everything. Personal information. Husband is in a hospital, and I become very connected to them on the way to the recall room. Goal 2 is, what's up with your morning AM meeting? Do you even have one? Please go back to the podcast, at least for tonight's purposes, that reviews what that morning meeting is about. It's basically to minimize the bumps in your day and maximize your productivity. Goal 3, I mentioned earlier already. Make this the year that you are in touch with the numbers of your business. What are you doing? What are you netting? Where are you inefficient? And that can give you a comparison of similar practices and the national average. And then goal 4, maybe should be goal 1. Have you checked out, at least explored your state or your province requirements for a moderate sedation permit? Even if you don't do surgery. That's the number 1 skill set you'll ever bring into your office, in my opinion. It's brandable. It attracts patients. I guess I'm thankful that more of the local dentists have not embraced it. I've done it for so many years. I don't think they'll ever do it. And I have a special oral sedation cocktail that almost all you have by now, and Beth will be glad to send it to you. This is getting long and winded. Not winded, I hope it was good. I felt like it was a good one. I appreciate you guys more than you know. Hey, please write out to me. Let me know if you'd be interested in me having another guest. We could try it and not continue it if we don't like it. And I look forward to seeing you next week on the Lionhearted Dentist. Stay well, work hard, set some goals.